Hello, thank you for coming. My name is Ashley, and today I will be discussing just how important it is how your medical records are stored. Like most people, and many of you here today have visited a doctor at some point in your life, has it ever crossed your mind exactly how your important medical records are stored? Today I will discuss the positive and negative of paper medical records. There will be three main points I will discuss. Those are why paper medical records are severely limited, improved efficiency and productivity, quality of care, and patient safety. The first thing is why paper records are severely limited. Well, it's no secret that doctors have very bad handwriting. Most of the time you get your records, you can't read them. Being papered, that's probably smeared over time. Paper records cannot be electronically shared. So if you're traveling, they can't be shared with another doctor out of state, or if you go to your local ER, they can't be shared within other practices to make it convenient and easy for you. They are expensive. Paper medical records are expensive just in general to make the chart, which then in return causes the charge for patients to get their own personal medical records a little more expensive because of the extra cost that comes with the paper medical records. Paper medical records are also very easy to destroy. I know I would like to think that I could access any of my medical records at any time with any of my doctors, no matter how far back I need. However, with paper medical records, they can be easy to destroy, such as a fire or water damage, anything like that. And almost now every industry is computerized or digitalized for rapid data retrieval and trend analysis. I'm going to start with one example of a medical record written documentation from a doctor. As you can see, it looks like it's very hard to read. The doctor's handwriting is very sloppy. The allergies are not listed. All the vital signs are missing. The physical examination of the patient is not there, has not been documented. It does look like the assignment is complete, but it's not very clear, and you can't really read some of what it says, and you don't really know what the outcome of that visit was. Sometimes medications do not get documented. Just the nature of paper charts, it's hard to get everything on there. This is another example of a paper chart that it is basically all blank. The blood pressure did get on there, the medication list did get, and just the little notes on the final assessment for the patient of what's going to be done. The next thing we will discuss is the need for improved efficiency and productivity. Lab results can be retrieved and reviewed and relayed to patients very slowly. I know when I go to the doctor, I would like my results fairly fast. However, with paper medical records, they are retrieved, reviewed, and relayed to the patients a little slower. There are more duplicated tests with paper charts. I know you don't want your insurance paying for double the tests that aren't necessary or repeated tests that shouldn't be repeated. That's important because then the cost to you would be a little more expensive and you would have those additional charges for the extra tests that don't really need to be ran. And the lack of overall office productivity, that paper charts do keep the office a little busier, and the office staff maybe not paying as much of attention to the patients that come in the office because of all the paper flow and just making sure everything's prepared paper-wise. The overall quality of care and patient safety. With electronic medical records that this world is forced to go to. It does improve clinical notes. You can access it at any time, anywhere. It does reduce the duplication of any testing or any labs that need to be done. It does have the option to send clinicians the reminders to contact patients to have them come back in for more testing if need be. Let's see. Electronic problems summary list provides diagnosis, allergies, and surgery at a glance. That way you don't have to really keep up documentation with this. You can get your medical records and you'll be able to see all those at a glance, and it would save time for these small questions when you're at the doctor for the bigger problems. That way you don't have to go over those over and over and over. Now here is an example of an electronic medical record, which hopefully eventually all your medical records will be stored this way. As you can see, everything is fully in, all the allergies, the assessment, the blood pressure, vital signs, height, weight, all the important stuff. And it's really easy to read. You don't have to decipher the doctor's handwriting. It is your private medical records. You should know how it is stored and why this information is so important. That way you will have the confidence of always being able to access your medical records when you need them. For more information, you may visit www.practicefusion.com. This will give you the pros and the cons of paper medical records versus electronic medical records. Thank you.